Hello and welcome. Our hearts are more than emoji confessionals and construction paper creations. They are fist-sized engines that power the human body. Problems with the heart affect the entire body. No wonder then that heart disease is such an important public health issue. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or any kind of symptom of heart disease. Cardiac emergencies can occur at any time and at any age. Sudden cardiac arrest and heart attack are such emergencies. Even young adults suffer from sudden cardiac death due to their sedentary and stressful lifestyle. Without CPR, that's the immediate recognition, and CPR, the chance of survival decreases significantly with every minute that passes without life-saving measures. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. To begin with, we have Dr. Praveen Chandra, Chairman of Interventional and Structural Heart Cardiology, interventional cardiologist from Medanta, Medicity in Gurugram. We also have Dr. Pritam Kumar Chatterjee, consultant interventional cardiologist from CNMCH in Kolkata, and Dr. N. Sivakadaksham, a consultant cardiologist, Siva's Cardio Diabetic Care Clinic in Chennai. Thank you so much and welcome to the show. Let me begin my first question and take it to Dr. Chandra. Atrial fibrillation is a very common type of heart rhythm problem. What is it exactly and what causes atrial fibrillation? Dr. Chandra.
Okay. So thank you very much, Divya. I think this is a very important questions because home care, as you were already telling, is the first thing we have to do or encounter when a problem happens. So atrial fibrillation or irregularity of the heartbeat, because as you all know that the heart beats at a regular rate from birth till death, and generally the rate ranges between 60 to 100. In this situation, which commonly happens in elderly age groups, in patients who have diabetes, in patients who have high blood pressure, in patients who have heart blockages or heart diseases, this thing can happen. And in this situation, the heart starts beating chaotically. As you can understand, it becomes very irregular, very chaotic, very fast. And that, if that continues to happen, then the heart cannot tolerate and the pumping power of the heart becomes low. So that means it needs to be treated very quickly. And we have to recognize this problem. So if somebody has a feeling of bumping in the heart or palpitations, this needs to be checked. The pulse rate needs to be checked. And this is diagnosed by doing a ECG testing. And most of these people, as I already said, and it also happens whenever there is an acute problem, like somebody has a infection or in the hospital for some other illnesses, this heart can become irregular. And also in the end, I can tell you, it's also known as a holiday heart syndrome, which means when people drink too much on weekends or they drink excessively, this kind of irregularity of the heartbeat can happen.
Right. Let me take my next question to Dr. Sivakadaksham. The cardiovascular diseases that have now become the leading cause of mortality in India, why are Indians more prone to cardiovascular disease?
That's a wonderful thing which predispose you to heart attack. Conventionally, all over the world, it is said that tobacco usage, diabetes, hypertension, obesity, high cholesterol, and all these things. But if you look at the epidemiology, Indians are at a higher rate of mortality and morbidity from cardiovascular diseases. This has been going on as a research for the past 40 years, especially by a person of Indian origin by name Professor Enas A. Enas, who is chairing the chair in Illinois for the incidence of coronary artery disease in South Asians. And he had found that we are more prone, 4 to 5 times more common than an American, 8 times more common than a Japanese, and 6 to 7 times more common than a Singaporean, and 4 to 5 times more common than a person who is living in UK. So what they did was they started selecting people who had settled in these foreign countries, Indians who have settled in foreign countries for more than 3 generations. That means their lifestyle and food habits would be almost similar to the country wherein they are living. And even after the third generation, they had found the incidence of coronary artery disease is high, cardiovascular disease is high in Indian settlers. That means we are genetically predisposed. And some of the factors that he had found is what is called increase in homocysteine level, increase in LP little a, lipoprotein little a. These are the things that we are working on that. Whether they are definitely, if controlling them will decrease the age of coronary artery disease in Indians is still a question mark. But another pattern in Indian patients is we get coronary artery disease, that is the heart attack, 10 years to 15 years earlier than a Westerner. So normally, if the age for a heart attack is above 60, Indians get it between 40 to 60. And when we do an angiogram, we found that coronary arteries are also small and they have diffuse vessels. So the cardiovascular surgeons find it difficult to anastomose. And even after this, when you look at the results, the recurrence rate after an angioplasty and bypass surgery is also very high because the disease is very diffuse and in multi-levels.
Right. Let me take my next question to Dr. Chatterjee. What happens if you have an abnormal heart rate, abnormal heart rhythm? What is the most common serious heart rhythm abnormality? Dr. Chatterjee.
Thank you. Actually, abnormal heart rhythm means either it may be slow or it may be very fast. There are different types of symptoms and different types of outcome. In case of most dreaded is this high, fast and irregular heart rate, that is we all know as atrial fibrillation. Though it happens in atrial fibrillation, what happens is that the heart is beating at a very fast but irregular heart rate, so that the blood circulation cannot happen. So it actually leads to most commonly what is known as a stroke, because there is a blood clot, usually chances of development of blood clot in the heart, which may get dislodged and go into the brain and can cause a stroke. It is one of the most dreaded complications of atrial fibrillation. Also, in a long-standing atrial fibrillation, if patient is having permanent atrial fibrillation, then there is chances of development of heart failure that increases quite significantly in a patient than those who don't have an atrial fibrillation. And also, atrial fibrillation, this long-standing atrial fibrillation, this increases the chances of the sudden cardiac death. So, atrial fibrillation is the most dreaded, and we should take care of diagnose it. It is quite simple to diagnose with ECG, and we have to look for a patient who are particularly prone for development of atrial fibrillation, particularly those in aged patient or those with having hypertension and coronary artery disease. We should screen for atrial fibrillation so that this complication of development of blood clot or sudden cardiac death or development of heart failure can be prevented.
Right. Dr. Chandra, what should be the response of a person who observes a person clutching onto his chest and then falling down? What things need to be checked before starting CPR? Dr. Chandra.
Yeah. So this is, a very, very important thing for people to know what should be the first immediate response when somebody collapses. So if you see somebody who is, clasping the chest and falling down, that means he has developed a cardiac heart attack and a cardiac arrest. Cardiac arrest means that the heart is completely stopped. So how do we know that? So you immediately make the patient lie down on a hard surface, maybe on the ground itself. Do not hesitate to put the patient on ground straight, and then assess whether he is breathing. Is there any sign of life or not? Which means that the pulse, which you can put a hand on the neck arteries or just on the heart and see if there is nothing happening, no pulsations, no breathing. That means he has developed a cardiac arrest, cardiopulmonary arrest, and that is the time when we have to initiate the process of CPR or cardiopulmonary resuscitation, which is a very emergency procedure, and it can save lives if it is done properly and also done at the quick time. So response rate has to be very quick. So Once we recognize this, we have to immediately shout for help, because you cannot alone take care of this person. So shout for help, then earliest, easiest person should come in, and he can make a call to the emergency medical services. And if there is no sign of breathing, then start making a mouth-to-mouth breathe and give cardiac compression. And cardiac compression should be very forceful, not that much that you break the ribs, but certainly forceful enough to compress the heart. It should not be just touching it. So we have to give a full force and make the heart start beating with your own hands. And you continue this for about, maybe 1 minute. See if there is anything happening or not. If not, then you keep continuing this compression and keep giving respiration also. Compression is very, very important. And you have to continue this till you receive a medical help, or you are tired, you give it to another person who can do it. But do not leave the patient like that, because that will not make him save his life. So continue, and we have seen, I have treated those patients where we continued this for 45 minutes and still the patient could go home. But then it is very, very intense. We have to do it continuously. One person cannot do it. He take help of other people by shifts, and once he starts breathing, once he starts getting a heart rhythm back, then we can immediately shift him to a medical facility. So this is the process of CPR, and you already mentioned that if you do it at the right time, right way, lot of lives can be saved. So that is very, very important. And also at the same time, I must say, now there should be more information or knowledge about the automatic external defibrillator, which should be available in public places. So in case somebody collapses in a public place, also one should try to use the AED, which is the automatic external defibrillator. And I'm sure many such defibrillators will be available in future in most of the public places in India.
Right. My next question is for Dr. Sivakadaksham. Cardiovascular or heart-related emergencies are common and often cause several deaths. What are some common heart-related, emergencies, Dr. Sivakadaksham?
I would recall at least 3 main types of cardiac emergencies. Middle of the night or early morning, people just come up with sudden onset of breathlessness. This breathlessness usually is secondary to what we call as pulmonary edema. We also call it as ADHF, acute decompensated heart failure. What happens is they go to bed normally, but their pumping capacity is slightly reduced or more reduced because of some previous disease in the heart muscle, and they suddenly wake up in the middle of the night rushing towards the window for breath. And this is what is called acute pulmonary edema. This is one cardiac emergency. The second cardiac emergency is acute chest pain. Patient comes with acute chest pain, a compressive in nature, with radiation to the lower jaw or to the left arm, and he says, I have never felt such a pain in my life. It is like keeping a heavy stone on my chest. This is the second most important cardiac emergency. Usually we attribute it to angina or a massive heart attack. And the third one is what the other 2 cardiologists were talking, a sudden onset of palpitation. It can occur at any time. It can be due to atrial fibrillation, but if it is going to throw the patient down with sudden cardiac death, it is due to ventricular fibrillation or ventricular flutter. So what is important is these 3 are the common cardiac emergencies: a palpitation or a breathlessness or a severe chest pain, for which they seek the medical attention immediately.
Right. Thank you so much, Doctor. We will continue our show on the other side of a very short break. Do stay with us. Welcome back. Let's get our expert doctors to take us through the topic of the day. We just discussed right now that sudden cardiac arrest is an emergency. What are the existing heart conditions which can lead to sudden cardiac arrest? Let me take this question to Dr. Chatterjee.
The most sudden cardiac arrest is mostly defined as that the patient usually dies within the first hour of the onset of the symptoms. So most commonly it is due to the ventricular fibrillation, the arrhythmia, abnormal arrhythmiasis, ventricular fibrillation or flutter. But the causative agent of this ventricular fibrillation mostly commonly is associated with the coronary artery disease. That's the acute heart attack can cause sudden massive MI, myocardial infarction, can cause this sudden cardiac death. Also, there are various arrhythmogenesis, this abnormal heart rhythm abnormalities, which are some genetically derived. They can also cause, like there are few diseases which is known as the hypertrophic cardiomyopathy. That is, as we see in few athletes are dying in the sports during this sport because these patients are mostly having an inherited abnormality of their cardiac muscles that predisposes them to development of sudden onset ventricular tachycardia, ventricular fibrillation, ventricular flutter, which is the prime cause of death of such young patient of young age, because these are inherited problems of their cardiac muscles. Also, there is known as the arrhythmogenic right ventricular dysplasia. This is also an inherited causes of RV muscles, right ventricular muscles problem though. So this type of diseases can cause sudden cardiac death. But most commonly in India, it is mostly due to coronary artery disease, that sudden heart attack, acute myocardial infarction, that causing one of the most common cause of development of causing sudden cardiac death.
Right, Dr. Chandra, if a person performing CPR is not well trained, how does he know when to stop performing CPR, and what should the person do after performing CPR?
So basically, this is a very important thing for our society, and in general, people must know something about CPR, because lot of patients and lot of people in family, in friends, they suddenly, they develop this problem of sudden cardiac arrest, and then there is nobody to take care of that. And that golden moment of those few minutes, if that is lost, then we can't save these patients. Even if we are able to save, their brain activity goes away. So CPR should be done immediately as it happens. And if somebody is now doing a CPR, compressing the chest, and starts seeing that there is signs of life, then he should make arrangements for the patient to move to the nearest facility. But if it is no sign of life, then he should continue this CPR with the help of the other person. So one should take turns, like 5 to 10 minutes each. They should keep compressing, change over, and then once the patient starts showing signs of life, they can then shift the patient to a nearby facility. And of course, this training, CPR training, is very simple. It doesn't take too much time to learn or know. One can even see it from YouTube videos, or one can go to the many heart association videos where the way to do CPR is available. One should not shy away from doing such kind of thing.
Dr. Sivakadaksham, does CPR apply in both conditions, to cardiac arrest as well as heart attack?
Cardiac arrest, CPR is a must. If the heart attack causes a cardiac arrest, all heart attacks do not cause cardiac arrest. They only cause pain and ECG changes, enzyme changes. But due to a heart attack, if the person suddenly collapses, as Dr. Praveen Chandra said, we will have to look at his pulse, see his response. If both are not available, that means with the heart attack, he has gone in for a cardiac arrest. So all cardiac arrest requires CPR, but not all heart attacks will result in cardiac arrest.
Let's also take my next question to Dr. Chatterjee. Cardiopulmonary, this is CPR that we are talking about, is a life-saving technique. What exactly happens during CPR?
Yes, the technique is very simple. A common man also can do it if they have some information prior. So what the thing is, when the patient collapses and patient pulse is not available, we have checked for responses. If that is not in, patient has gone for cardiac arrest. So there are three things to remember. One is CAB. C is for compression, A is for airway, and B is for breathing. So those who are not trained in CPR, they can keep away the A and B part. The most important thing is the compression, which maintains the circulation. So what we have to do, that you have to place the patient in a firm surface, and we have to kneel down near his chest and take the heel of the palm and put it over the sternum, that is the breastbone, and put another hand over there and give rapid compression like this in a 100 to 120 per minute. And we have to keep in mind that the chest should be get compressed, and we have to give time to it recoil back, and then again have to compress. We have to go for 100 to 120 beats, 120 compression, and the depth of the compression should not exceed 6 centimeter. The average it is 2 inch, that is 5 centimeter, that is sufficient. And if aid is coming, or think that the next step is to we have to secure the airway. So what we have to do, we have to lift the head, and you have to tilt the head and lift the chin like this, so that the airway gets patent, and we can give a breathing. Also, the last part is that we have to give mouth to mouth breathing, or sometimes mouth to nose breathing can be given. And so we have to look that the 2 breath should to be given, and we have to see whether the chest is rising or not. Then we have to again go for the chest compression. So we have to think the most important thing is that the compression. We have to, if the airway breathing is not done, it's still okay, but the compression has to be go on for 100 to 120 per minute until the aid arrives.
Right. Let me take my next question to Dr. Chandra. For decades now, aspirin has been used to prevent and manage heart disease and stroke. What's the role of aspirin in the treatment of heart disease? Dr. Chandra.
Yeah, okay. So, Divya, this is a very, very important drug. The cheapest drug for treatment of heart disease is aspirin, and basically it is being used for ages now. So how do we use aspirin? Who are the patients who should get aspirin? I'm just going to tell you now. So whenever there is a heart attack happening, if somebody witnesses a heart attack, the first drug to be taken is aspirin. A tablet of 325 milligram tablet should be crushed, mixed in half a glass of water, and given to the patient immediately. So we have seen that those patients who come after taking aspirin, generally the heart attack starts settling down, and the results in these patients is much better. However, those people who are already having heart disease and who are undergoing angioplasty or bypass surgery or any artery blockages, these patients have to take aspirin for the whole life. And the dose of aspirin which we give to these patients is just a small baby aspirin, 75 milligrams or 150 milligrams a day. This has to be taken in the night time after having meals, and generally it is very safe to take it. But at the same time, it has been seen that it is not recommended to those people who have diabetes or, for example, high blood pressure and do not have any documented heart disease. There is no need to give aspirin, because it can also lead to complications like bleeding in the stomach or acidity, and these problems happen. The hemoglobin can go down. So it is to be only given once the doctor recommends it. One should not try to take it oneself. The only time they can take it by themselves is at the time of a heart attack or serious chest pain, where a tablet of aspirin can be dissolved in a glass of water, half a glass of water, and has to be taken. At the same time, those people who have stroke or any history of stroke, like paralytic stroke, they have to also take the aspirin. So heart disease and brain disease, in both diseases, aspirin is a very good medicine for treatment for the whole life.
Right. Thank you so much, Dr. Chandra, Dr. Chatterjee, and Dr. Sivakadaksham for joining us on the broadcast today. With that, we're slipping into a very short break. Lots more coming up on the other side.